and a special call out to Tim and Steve and Catherine and Janessa and Dale for being online with us today to help in our discussion if need be. So also want to welcome people that are calling in, and some are going to be online to provide comments and some are going to be online just to listen. So I appreciate all of the people that are listening in on this discussion. So we do have one business item on the agenda today, and it's for the Board of Health to review and provide input to the City of Eau Claire and Eau Claire County proposed ordinances related to communicable disease. I want to say that we received many written comments, as well as some of the people that I said will be speaking today. I want you to know that we have reviewed all the comments and appreciate all of your input. Do know that the public will also have opportunity for input as this ordinance follows through the city and county process. And again, today the Board of Health will be deciding what input to give the city and county. Before we begin the public comment, I would like to ask Janessa Stromberger, the Assistant City Attorney, to provide all of us with a brief background to clarify what is included in this ordinance and how we can think about it. To Board of Health members, we'll be having more opportunity to interact directly with Janessa when we get into our business meeting. So Janessa, if you're ready to start.
Certainly, and thank you for the opportunity to address the ordinance right at the beginning here. So first of all, I'd just like to talk about what this ordinance does. So it really provides legislative oversight and public input for the issuance of a general health order of applicability. It allows for the ability of the legislature to overturn an order issued by a health officer if they should disagree with it in part or in whole, and it allows for public input into that legislative process. The ordinance also allows for constitutional safeguards that are necessary, of course, both procedural and substantive. And so this ordinance is really for a narrow category of orders, just for those orders that are affecting the population as a whole when we need a general order of general applicability. It leaves intact the health officer's ability to quarantine or isolate or address specific outbreaks, and those are statutory powers not addressed at all by this ordinance or limited or narrowed in any way. So this is really a limited narrow use ordinance. It's only applicable when the health and lives of residents are threatened due to a highly infectious, novel, or unusually difficult to treat disease. And this ordinance allows for the quick, educated, and informed response by the health officer by enabling them to act in such a manner. This ordinance does not expand existing health officer authority beyond what is already granted by statute, and it does not restrict the legislature's authority to directly legislate on an issue either. So again, this ordinance provides legislative oversight and public input while allowing for the issuance of an enforceable general order of general applicability, while also providing those constitutional safeguards, both procedural and substantive. So that's just a quick overview of the ordinance, and again, I'm happy to address any questions later in the meeting that the board might have.
Thank you, Janessa. That was really helpful. So next, I would like to move into the public comment section of our meeting. For those that are doing public comment verbally here, it needs to be pertinent. Your statement needs to be pertinent to the agenda item, and it will be limited to 3 minutes per person. We have 20 people that want to speak, so to get everybody fit into the schedule, know that we are sticking to the 3 minutes. You'll receive a 30-second warning so you can sum up what your point is, and you will be muted at 3 minutes so we can provide adequate time for the others to also speak and give everybody that opportunity. So with that, Tegan, could you start the public comment process?
Our first public speaker is Kayla Rick. Kayla, are you on the line?
Yes, I am. Can you hear me?
We can hear you. Please go ahead.
Well, thank you for taking my comment and for the servitude to the citizens of Eau Claire. In this city, we have lost the right to assemble and give in-person public comment in meetings like this, and I'm calling you from the lawn in front of the courthouse where a group has gathered to oppose this ordinance. We want any future meetings regarding this topic to allow in-person public comment. There are multiple venues in Eau Claire that could easily, safely host us. This same ordinance has been on the agenda of multiple counties and boards across our state. Several other counties are allowing for public in-person comment, and we want the same. I'm calling in today to give my statement in opposition of this ordinance in the name of health and safety for my children and family. Citizens who want to maintain their freedom to decide what is healthy and safe for themselves are being discredited because we're not medical experts. While it's true that I am not a medical expert, and many of you on this board are, I am an expert on my health and my children's health. My oldest child was chronically sick when she was a baby until about age 4. During that time, we sought out help from numerous medical professionals and received tidbits of advice and usually told she just had a virus and kids are sick all the time. After 3 years of illness, treating her with pneumonia 4 times a year, multiple episodes of vasovagal syncope, we finally found a doctor who diagnosed her. She had an active case of colitis at the age of 3 because of food she was eating and was lactose and fructose intolerant. Additionally, she had asthma. At this point, our family has had a crash course in nutrition and how the systems of the body work. While I appreciated the genuine kindness and concern of all the wonderful doctors we saw, it took me, as my child's advocate, to get her to a place of actual health and wellness. Even after we had a diagnosis, we did not find health for her in modern medicine. Her treatment plan was to trial and error with foods and give her a prescription that made her so groggy that she slept all day. When I asked for help, I got symptom suppression. I do want to note every doctor we saw did their best to help us, and I was thankful for a diagnosis. But it was while following that plan that I began to question my belief about healthcare and realized that modern medicine is able to diagnose and prescribe medication, but not able to provide healing or a cure. I started seeking alternative care and learned everything I could about how to use food as medicine. She is now a much healthier 8-year-old because I advocated for her as her mother and treated her with appropriate foods, limited toxins, appropriate supplementation, and faith. She's been prescription-free, pneumonia-free, and symptom-free for years. It's clear this ordinance is for the purpose of enforcement, specifically to be able to penalize and control businesses who choose to respect individual choices. I ask that you choose respect for individual choice and personal responsibility by opposing this ordinance that would allow intrusive government overreach. Thank you for your time.
Thank you. Our next caller, or our next public speaker is Pamela Johnson. Pamela, are you on the...
Yes.
Can you hear me?
She's not happy.
Yep. Yes, you can go ahead.
Okay. Hello. Thanks for giving me the time to speak. I strongly encourage that at the next meeting we are able to communicate by phone or email. I oppose any new ordinance. I do agree with Emily on her email comment that there is a very large misunderstanding. And in my opinion, it's vast, it's worldwide, but it's not the citizens that are misinformed. It's the government entities that think we're stupid. I've spent the last 5.5 months researching, reading, watching, and trying to answer my main question, why, to everything. It's exhausting trying to figure out what is truth and what is lie. Data, stories, and rules are constantly changing to fit the narrative, our compliance. Do you have any idea, as an American citizen, how my stress level goes up when I read another part of Emily's email? This ordinance does not give the local health officer any additional authority beyond that granted by statute, but provides the necessary legislative oversight to enforce general orders of general application. I can only speak for myself, but I've certainly had my fill of authority and oversight. I don't want the U.S. becoming China or Australia anytime soon. I want to feel safe inside my own home. I believe there never was a true pandemic, that the COVID death rate is the same as any other flu strain. Did we shut the world down for H1N1, SARS, swine, MERS, where honestly there were more deaths? We can't stay away from viruses. They are a part of us. It's how we stay alive. If my government truly cared about my health, all the media would be talking about is how to be healthy. Vitamin D and C, no processed food laced with Roundup, exercise, and fresh air for starters. And if I get the flu, whatever strain that may be, I need to stay home, wash my hands, avoid touching my eyes, nose, and mouth, maybe eat some chicken soup, protocol we've been following for decades now. We've had a flu vaccine for 78 years, and guess what? We still get the flu. If I feel worse, I could take antibiotics with zinc and hydroxychloroquine, but Big Pharma won't allow that info into the mainstream media. Doctors and nurses are losing their jobs for speaking out. None of what is really happening here has an iota to do with a virus. I believe that citizens should be free to exercise their natural right to practice medicine as they see fit. To that end, I align myself around the foundational premise that the body is inherently wise, that symptoms are meaningful, and that radical healing is highly possible when we honor our place in the natural world. In short, my body, my choice. Thank you.
Thank you. Our next speaker is Annie Camden. Annie, are you currently on the line?
Yes, I am.
Okay, you can go ahead.
All right. Thank you for taking my call. Nobody should be forced to leave their home. Isn't that their choice? I think the statistics and about what we know about this virus 6 months into this, it is pretty evident that we are taking actions that are stripping people of their constitutional rights. I'm a United States Air Force veteran. I fought for those rights. You guys are taking life, liberty, and the pursuit of happiness. So I want you all to think about the people, their rights, and what this ordinance is doing, which is granting you guys power over the citizens of Eau Claire. Not to mention, I'm a single parent of 3, and the guidelines for testing children at school for minor symptoms of COVID, which you guys do, the kids will develop a huge anxiety about going to the doctors, and not to mention missing school for 10 to 14 days. That's a lot of education missed and hard to make up, and not to mention the toll it takes on their mental and emotional health, which you guys claim you're for. If they are subject to this test frequently due to minor symptoms, I'm concerned also for the parents that have to put their kids through it and could potentially lose their jobs because of you guys, because of extended work absences as a result. What I'm trying to say is that the current policy and the new ordinance for more control over the citizen is traumatic for the kids and detrimental to business owners relying on an income to survive, both of which will have significant long-term consequences. After realizing and reading the proposal and getting a response back, I clearly see that the health department is seeking more power. Let law enforcement enforce the laws. Let us stand up for what our constitutional rights say. And the virus is part of us. That's how we live. If we don't have the virus, our immune systems are... What do we have immune systems for? Thanks.
Thank you. Our next caller, or next speaker, is Julie Court. Julie, are you currently on the line?
Yes, I am.
You may go ahead.
I would like to thank you for taking my call today and for your willingness to be involved in this issue. I am very discouraged. I am very discouraged.
I'm like, what is that?
Is there talking?
I'm sorry about that, Julie. I'm going to pause the timer for a moment. If you're on the line, could you keep the down just a little bit? I can't mute the callers unless I can hear who the caller is.
I'm actually away from the group. It's someone else, not me. Okay. I don't know who's not muted, but it's not me. I'm standing in the parking lot.
Oh, this is working out really good.
Julie, give me just one moment. Julie, can you hold on for just one moment?
Yes, I can.
Julie, can you try going ahead again?
Yes, I can.
Go
I
right
would like
ahead.
to thank you for taking my call today, and I'd like to thank you for being open to this issue. I would like to express my dissatisfaction with this meeting being held online. I was involved as an essential worker at a local homeless ministry. There are people who work in the grocery stores, gas stations, factories, and quite frankly, it's appalling to me that you would take something such as important as this and then hide in an online meeting when there are people out here who are very, very interested in giving their opinion. Second of all, I would like to express my vehement disagreements with giving any unelected health officer any more power because they were not elected, and I believe that the things that were already put in place by the legislator and the Supreme Court of the state of Wisconsin are sufficient to move forward with. You are actually, in going forward with this measure, I believe that you are violating multiple rights of Wisconsin citizens under our Wisconsin Constitution. You are meaning to take away our rights with less than a 1% death rate and less even than a 1% result in our country. Most pandemics have millions of deaths. H1N1 had over 200,000 deaths. And so I truly, truly believe that this is not a pandemic. It is actually a case-demic. In Eau Claire, there have been less than 10 deaths total that were attributed solely to COVID. This is not a pandemic. According to the numbers, we have tested 20% of the population, and yet we have 1% of our population that has tested positive for COVID. That is also not a pandemic. I am not willing, nor will I ever submit to someone taking away my rights for a fake pandemic. The CDC has revised their numbers down from inflated numbers where they were actually saying that people who weren't even ever tested for COVID were positive. And so before instituting any such measures, giving more unelected officials power and authority over me, my children, our family, our businesses, and our community, I suggest that we work on actually looking at not just the number of cases that are positive, because
30 seconds.
people have been exposed and gotten over COVID and never even know that they have had it. And so I would like to propose that because the people have actually gotten over it, that the pandemic, we are well able with our natural immune system to take care of this in and of ourselves. So I would just like to add that I am totally against what this is being proposed by the Liberal administration, and I thank you for your time. Thank you.
Thank you. Our next speaker is Claire Krenzalak. I apologize if I'm mispronouncing your name, but Claire, are you on the...
Yes, I am. Can you hear me?
I can hear you, Claire. Please go ahead.
Perfect. Hi, my name is Claire Krenzak, and I just want to say thank you for giving me the opportunity to speak today.
Yeah, Claire's speaking now, and man, half of them have gone.
I want to say that I really would appreciate if these meetings were held so that the public could actually be seen and heard. I am currently sitting outside the courthouse on the phone because we are not being seen and heard by our city council members. I would also like to, some things were already said that I had wanted to speak about today, but I absolutely reject any ordinance that infringes on our inherent rights that we are given in our Constitution. And I just want to talk about the Declaration of Rights in Section 1 of political powers and people. All political power is vested in and derived from the people only. Therefore, we have the right at all times to modify their form of government. I 100% oppose any unelected health official to have endless power to do whatever that they seem or deem necessary. I also do not in any way agree that our Constitution allows for this or allows for them to have searches and seizures to walk into my home, walk into where my kids are going to school, and decide for me and my family what is best for us. I mean, we have to talk about children and children with special needs. There's so many things that are wrong with someone having the power to make those decisions. And I just want to ask that we honor our Constitution and we hold ourselves accountable to that. I also I need a lot more clarification. This is so vague. We know that COVID is real, but are we really going about this appropriately? Part of my thing that I wanted to speak on was H1N1. The cases to COVID are absolutely, COVID is nothing incomparable to that virus. And here we are all locked down and all these overreaches of government being taken out on us. And I would really like to know if does any implementation of an ordinance release additional funding for the county? Why are we pushing this so hard? What is it? Is this money part of like the care program? I have a lot of questions. I'd really like to know exactly specifically the outline of what this health officer has, and we the people should vote for what we think our health officers should be doing. And I'll leave it there before I go off. Thank you so much. I appreciate your time of serving our community, and have a great day.
Thank you, Claire. Our next caller is Peg Gravrock. Peg, are you currently on the line?
Yeah, you're one of many voices.
Whatever, so
Peg?
Yes, I am. I'm here.
Okay, please go ahead.
I don't know if we talked about that. If we did, whatever.
Okay, first of all, I would like to strongly encourage that the next meeting that we have regarding these, the situation that we would have in person and not via a call. Obviously, we're having trouble with hearing what others have to say, and also there are many people that want to be seen and are willing to stand up, but their voices are very shaky, and so they feel very intimidated about speaking up, but yet they still agree with what we're saying here. And I'm here to express my strong opposition to the amendment to do any kind of expanding the powers. And I understand that you're talking about narrowing the category of the powers, but I understand that preserving our personal liberties is indeed listed along with the quote, allowing necessary and prompt response in times of public health and emergency, end quotes. My issue is with the supported by the best available scientific understanding as informed by the local condition in the city of Eau Claire. Unfortunately, the, quote, best available has had numbers inflated and later retracted on a national level. In other words, we have inconsistent data which is being used to undermine our liberties and to cause fear and panic. The medical data for Eau Claire County does not support this overreach. There have been major disruptions in people's lives due to that overstatement. The medical data for Eau Claire County doesn't support this overreach. There have been only 6 COVID death cases in Eau Claire County for over 100,000 people. 6 deaths, and while that's an individual tragedy, it does not equal a pandemic. The testing done, as one of the earlier callers mentioned, that our test population, 19% out of the 20% of our test population tested negative for COVID-19. Again, not a pandemic. This ordinance amendment is about protection, but we do not have a major issue here in Eau Claire County. We did the lockdown. We flattened the curve. If there was indeed a true epidemic, we wouldn't need the media or government officials to be reminding us of such. We'd see it. We'd know many of who have died from it. We wouldn't have lockdowns and governmental overreach for annual flus and the proliferation of colds. We don't need extra precautions at this time either. The power of the health official to create and enforce government mandates and potentially any open-ended power to an unelected official to do as they see fit and by any means necessary is dangerous, and it goes against our Constitution. So we see that with the Wisconsin Supreme Court clearly ruled that our state officials overreached with the lockdown earlier this year. We don't need that to be happening again. Again, thank you for your time. Please have the next meetings be in person. There are many avenues to, or many places to do this. So thanks for taking the time to listen to us.
Thank you very much. Our next speaker is Amber Richards. Amber, are you on the line?
Yes, can you hear me?
I can hear you. Please go ahead.
Okay, thank you. Well, hello, Health Board. Thank you for taking my call. Just want to be on the record to strictly oppose the agenda item to amend the Chapter 8.04 to add more power to local health officers. First of all, I think that public comments should be in person for future meetings of this sort, so have that be on the record. Secondly, an unelected official, any person with the health department that is an unelected official should not be granted more power in our representational form of government. It is not constitutional. I also support small businesses. We need to allow businesses to be open and run their own businesses without more restrictions or fear of closures due to power granted in this ordinance, or any type of oppression through fines or any other things like that. I also fear strongly the unintended consequences and the ripple effect of these types of restrictions to health freedom in general. So my last comment would just be, please do not move forward on this amendment and actually restrict and take back the types of impositions you're already putting on our community. Thank you.
Thank you, Amber. Our next speaker is Dory Pulse. Dory, are you still on the line?
I am. Can you hear me?
I can. Please go ahead.
Well, thank you for this time that I have to speak. I sincerely appreciate your efforts, all of you on the board, as you serve. I do not like confrontation. I don't like trouble, and I hate evil. We are in the midst of very troubling times. Our freedoms are being stripped away. Our churches are closed. Businesses are suffering or have closed. I personally have experienced friendships of over 40 years broken by politics and this COVID virus. Family members acting out in anger. I do not believe that this virus is any worse than any other illness or virus that we've dealt with in the past years. I'm going to be 68. I haven't had a flu since 1977. It was a Hong Kong flu. I haven't had a flu since. I take supplements. I take care of my body. I'm in charge of my health. So, a question, is there currently a state of emergency in existence in this city or county? Is there justification for declaring a state of emergency in the city or county? I don't think so on either count. And mostly, what efforts have been made to seek input from local residents and businesses? We are the people. This is America, the land of the free and the home of the brave. I believe in God, and I will obey authority until that authority oversteps what God has ordained as righteous for the good of all Americans by the Constitution of the United States. I am saying that this proposed ordinance is unconstitutional and unnecessary. And I, too, would greatly appreciate the ability to speak in person so we can see each other. Thank you for listening. God bless America.
Thank you, Dory. Our next speaker is Bradley Robb. Brad, are you on the phone?
Yes, I'm here.
Please go ahead.
And thank you. Thank you for your time. Thanks for everything you guys do on a daily basis, trying to keep us healthy and happy. I do have some concerns, and what I've heard in the past several comments really emboldens me to make the following statement, which is, I really believe that this is a chaotic and unconvincing way to show an organized, or for that matter, an honest method to listen and take seriously public input. I think that having the meeting this way is really a way to, to insulate yourselves more from comments than COVID. But I do have concerns also with the order, and my concerns are this, that number one, any unelected persons making law enforceable decisions about behaviors involving lifestyle, healthcare choices, vocations, self-expression, travel, and many others. It's unacceptable for that to happen, to grant such a broad overreach of power. The definitions that are given, and therefore the clarity of power, scope, domain, and duration and enforceability leave so much potential for some to control who wins and who loses. When you think about it, where is the decision about when and how much infection? Who decides what conditions? Who determines the best available science? I'm sorry, but this is all a little bit just too slippery for me. I wonder, where is the equivalent level of oversight, enforcement, and impact for other infections, addictions, health and lifestyle choices? I'm sorry, I'm not seeing it. Decisions affect lives. Decisions have the power to divide families, end careers, end businesses, and end the desire for some even to live. I work in healthcare. I work with frail elderly. I have seen face-to-face and heard the
30
word,
seconds.
I give up. I've had enough. For someone that has not even allowed to come out and see a table mate, that is one of the few things they have left. I believe that this is not lawful, necessary, or even ethical. Protecting the public health, safety, and welfare goes far beyond making or breaking a rule. Thank you for your time.
Thank you very much. Our next speaker will be Dr. Julia Carlson. Are you on the line?
Yes, this is Kayla Huntington. I'm speaking on behalf of Julia as she has patients currently.
Okay, please.
Thank you for the work that you're doing in this unprecedented time. I have unlimited compassion for those of you at the health department trying to make decisions that help everybody. My thoughts are personal. I see 200 people per week in my practice. Before the quarantine that happened on March 17th, 2020, there were several people in my office that had mysterious symptoms, though they were tested and negative for influenza. Some of them were out of their jobs for 3 weeks and out of their lives for 3 weeks. I couldn't help but think after I saw the first press conference held by President Trump that this is what people were sick with, and certainly it was no joke. Fast forward until now, and since March in my practice, I have seen thousands of patients. There have not been any confirmed COVID cases in my practice to date. My patients let me know when they're sick and when they get tested. My patients are wellness-minded, so they pay attention to their bodies. They stay home when they are sick. We follow proper cleaning protocols and carefully follow CDC recommendations for the clinic and review weekly to determine if any new guidelines have been set. They take their buffered vitamin C, their vitamin D3, and their zinc, which have hundreds of journal articles to back them up the science behind them. Even Dr. Tony Fauci admitted that he takes them in a recent interview. My patients know that I take mine. The lack of education on the health department's part on what people can do besides the baseline, wearing a mask, and getting a vaccination are maddening. You should be at the forefront of prevention information. My concerns over the particular agenda verbiage include the following questions. 1. What constitutes a measure necessary to prevent, suppress, and control communicable disease? For example, could you take a child out of their home and quarantine them away from their family? 2. What constitutes health officials doing what is, quote, reasonable and necessary for the prevention and suppression of disease? For example, mandating a vaccination. 3. Define outbreak and the definition of an epidemic as it relates to the local level and using what source to reconcile that decision. For example, using probable versus not confirmed cases of communicable disease. 4. Regarding enforcement of any regulation that the local Board of Health adopts. For example, wearing masks, taking temperatures, screening procedures for any outbreak. 5. Regarding, quote, using science as a frame to determine course of action. For example, are you using an outdated study or a one-sided research article to conclude the decision that is necessary to prevent, suppress, and control community disease? The vagueness of the agenda's content needs to be addressed fully and defined so that people know what the possible outcomes could be in regard to decisions made by the health department
and to keep the health department operating under the U.S. Constitution. Thank you for allowing me to share my thoughts, Dr. Julia J. Carlson. And again, that was given on behalf of by Kayla Huntington. Thank you.
Thank you. The next speaker will be Bethany Aberly. Are you on the line, Bethany?
Yes, I am. Can you hear me?
I can hear you. Please go ahead.
First of all, thank you all for taking the time to establish the technology to have us give input. I would request that you guys would work at having these meetings in person. I believe that much is lost when you can't see facial expressions. Technology is great, but it can only go so far. I'd like to go on record for strongly opposing this ordinance for several reasons. First, it's too vague. I actually read through this entire thing. And while it does sometimes limit powers, it also includes wording such as any means necessary or following the science. And while science is great, it's limited. There's often studies not done in time to make decisions. It's often manipulated, the data. Any means necessary, that's a very, very vague word. Very, very vague wording. You could do almost anything with that. That is very concerning. My other concern is that there are major health issues in the Eau Claire County. In fact, if you go to the Wisconsin Public Health Profiles, now they don't have a reporting in 2020, but they do have a reporting from 2017. And if you go to that, you will find that the major health issues in the Eau Claire County are cancer. In 2017, there was 142 people who died from cancer. There was 130 people who died from heart disease and 101 people who died from tobacco use or issues from tobacco use. None of those are communicable diseases. Now, I know the big communicable disease that's on the forefront of everyone's mind is COVID. There's only been 6 deaths. Now, I know that's personal because I actually have an aunt right now in Tennessee who has COVID. I know how that feels personally. But personal is not science. And if you're going to put science in here, you should be following science. I'm very concerned that the health officials are not focusing more on educating about cancer, heart disease, tobacco. Why are we focusing on communicable disease when that is not the main issue of death in Eau Claire County? So I'd just like to request that your officials, I know you spent a lot of time serving us, so thank you for that. I know you've taken a lot of heat, but please look at the science. Follow the actual science. Do not allow these controls that destroy mental health, happiness, and people to provide for their families. Thank you so much for taking my time and your time.
Thank you very much. Our next speaker is Rachel Schrader. Rachel, are you currently on the line?
I'm not
Rachel?
Yes, can you hear me?
I can hear you. Can you please, go ahead.
Out of the ordinance.
Let me know when I'm ready to go.
Oh, sorry, just one moment.
But I think it's just Orange Man bad, and it's the way to.
I don't understand.
Rachel, go ahead. If you want to go ahead and start speaking, I can mute the other lines as soon as I've got you going.
Okay.
So, why? Tell me the reason why. Because somebody told you. No.
It's a difficult job, and the work you do is very appreciated. I am a certified social worker residing in Eau Claire County, and I am concerned about the amount of authority that would be held by the public health officer should this ordinance continue. I do not know if you're familiar with the work that social workers are often called to do, especially while working for a county. Many job roles include ensuring safety of children, vulnerable adults, and even our community. Social workers are the individuals certified to remove children from their homes, not law enforcement, not public health workers, social workers. Given this huge safety of our children and community, we of course have standards we must meet. On top of these standards, we have state statutes overseeing the legal process that instructs our ability to enforce any changes in the home up to removal of a child and termination of parental rights. This authority is judicial process either by a judge or jury. We cannot do anything outside of what is permitted by those policies. If we step outside of our legal authority, we violate the rights of the parents and the family. We impact the integrity of our case, and it could even be detrimental to the safety of those we've been called to protect. We are also governed by a social work code of ethics, and any ethical concerns are governed by an ethical review board. All of these regulations are public information so that we can be held accountable to the public. The purpose of these checks and balances is to prevent personal bias from impacting the life-changing decisions we have to make, so that while we work to protect the community, we also work to protect the autonomy of the family and their rights to make their own decisions, even if it falls outside their own personal value systems. Now you might ask, why is this relevant? The public health officer ordinance that you are looking to pass has no clear guidelines, no distinct regulations, no written rights for the community members to contest actions taken by the public health officer, no due process. They are under instruction to use all measures necessary. Could this mean removal of children or other family members, mandated healthcare practices? Would you be forcing small businesses to enforce mandates when that could be detrimental to their business and dangerous for their employees? Could there be fines for individuals just for practicing a different value system? Without protective guidelines, a designated purpose, and community rights specifically listed, then we as community members have every right to speculate and fear how that extends. Now you can say that those things won't happen, but if you approve this ordinance, then there's no guarantee and therefore no protection. The statement I'm giving today has nothing to do with the effectiveness of interventions. This is a statement questioning how much unchecked authority one person should have over our community, our families, and our values. Checks and balances are integral to balancing health and safety with individual freedoms we are guaranteed in the Constitution. That is why I implore you to recommend rejection as it stands. Thank you for your time.
Thank you very much. All right, our next speaker is Carla Haig, or Haig. I'm sorry if I'm mispronouncing it. Carla, are you on the line?
I am on the line, but I am going to decline at this time making too much of a large comment. I guess it pretty much models a lot of what's already been said. And my biggest concern is giving too much power to one individual and doing so with, not the science, not the stats that support what's going on in our community here. Rather, it seems very fear-based and driven not by science, but rather as a detriment to our community and our rights as individuals and ability to live in this community. So thank you for your time.
Thank you very much. Our next speaker is Alma Koenig. Alma, are you currently on the line? Alma Koenig, are you currently on the line?
Hello? Can you hear me?
I can.
Okay.
You may go ahead.
Okay. So thank you for allowing me to speak, and thank you for all the people who have been already calling in, because they have expressed a lot of my fears. And I feel very, very strongly about this, and I know you have heard and you will keep hearing many concerns, and I believe they all boil down to one, which is this ordinance is going to take away our freedoms. I absolutely oppose the new ordinance in which you give power to one health officer over 100,000 people. This is excessive power over our community, our churches, our businesses, our very selves, our bodies, and our children. This ordinance would give away my individual rights to someone who I didn't elect, I didn't hire. I don't even know who hired this person or who would hire the person. And this person can make decisions for me, for my family, even if there is not a declared emergency. This is like, where are you guys going with this? This is really scary. They just have to decide that it is necessary. That was the language they used in the paper, necessary based on local conditions. This is totally subjective. They will also make decisions based on the best available scientific understanding. This is also subjective, because who decides who is the best available scientific what is the best available scientific understanding? What is this person's opinion? Because this is subjective. This is an opinion on what the best understanding is, scientific understanding is, differs completely from the opinion of our trusted medical doctors, nurses, doctors of chiropractic. We would be forced to live by the standards of these unelected health officials, and I find this unacceptable action on your part of the board. The health officials' role in our community should be to advise us on how to protect ourselves and what are the proper precautions to consider during a pandemic. I have not heard one thing about our immune system. Have you guys? Has anybody heard about our immune system, how to strengthen it? I haven't from the health department. The health officials' authority should end at that point, just in advice, and people should be allowed to make their own decisions on safeguarding their family's health. This new law goes way beyond that intent, and it is a direct threat to my personal liberty. These did not go through in Barron County.
30
it
seconds.
did not go through in Sheboygan County, and I really hope it doesn't go through in Eau Claire County. I immigrated here, and I did not immigrate to a communist country. I don't want to live in a communist country. Thank you.
Thank you very much. Our next speaker will be Lori Stoufferan. Lori, are you currently on the line?
Yes, I am. Thank you.
Please go ahead.
Okay. Thank you for letting me speak today. I appreciate that. On my concerns on this proposed ordinance. As has been stated, there are many concerns regarding this overreach. You are discussing giving unlimited powers to one non-elected health official. Enacting this would be violating multiple rights granted to Wisconsin citizens. Our Constitution was written for the people, not the government. You are meeting to take away the constitutionally given rights of a free people over less than a 1% death rate as of today. I want to remind you that we have both a state and federal constitution. Both are the ultimate law of our land. In both states, no one can create a law, ordinance, regulation, or provide powers to any single individual, entity, etc., that supersedes the said Constitution. The types of power and control you want to include in this ordinance steps all over our constitutional rights, including but not limited to the following: equality, inherent rights, Section 1, right to assemble and petition, Section 4, excessive bail, cruel punishments, Section 6, searches and seizures, Section 11, maintenance of free government, Section 22. I would be interested in knowing which members or member are responsible for drafting this ordinance, what the source of the ordinance is, what efforts have been made to seek input from local residents, why this ordinance is so vague and subjective and so intrusive and evasive. It seems the quote-unquote guidance may have been given from somewhere else, perhaps offering additional state funding. Most pandemics have millions of deaths. So far, we have had 6, which, while sad and unfortunate, is 0.0057% of Eau Claire County population. This is not a pandemic. So essentially, you are meeting to take away the constitutional rights of a free people over less than a 1% death rate. A mandate is not a law. The Wisconsin Supreme Court clearly ruled that our state officials overreached with the lockdown, and have no doubt that should you move forward to enact this ordinance, it would be an overreach as well. Please stop the power grab. We have a constitution, and you are infringing on our rights.
30 seconds.
Thank you again for our time.
Thank you very much. Our next speaker is Mindy Eichelberg. Mindy, are you on the line?
Good. How are you doing, Kevin?
Can you hear me? Mindy Eichelberg?
Eichelberger.
Oh, sorry about that, Eichelberger.
No problem.
Give me just one moment so I can find the line that's open, and I'll...
Okay.
Okay. Mindy, can you go ahead and go ahead now?
Over what I would say today and how to, in 3 minutes, convey enough information to affect the board's stance on these proposed changes. Can you hear me?
I can't hear you. Can you give me just one more moment? I can get the lines muted. Go ahead. I'll stop the timer. Just a moment.
Okay. Okay.
It doesn't help.
Is this good now?
Nope. Give me just one more moment.
They can tell you're a liberal because you're wearing the mask, all right? You're the one pushing this stuff. You're probably...
Okay. Mindy, go ahead now.
When you're through in 3 minutes.
Mindy? Mindy, are you still on the line?
I am.
Okay.
Can you hear me?
I can. Go ahead.
Okay. I'll start over again. In thinking over what I wanted to say today and how to, in 3 minutes, convey enough information to affect the board's stance on these proposed changes, I find myself with a fundamental dilemma. How do I try to convince someone not to attempt to take more power over me when they can now vote to try to grasp it? Especially when they have repeatedly in the past months made that decision to take a strong authoritative role over my life and health decisions. I think the answer is I can't if you as a board are not willing to listen to the call of doing what is right. What argument can I give, since most of you were not elected by us, that would have any weight if you are not willing to do what is right? You already have, as a board, decided that your views of my and my family's health and well-being is best left in your hands and not mine. I find this deeply offensive, not only from a moral viewpoint, but also because I have the most at stake, not you, where my and my family's health are concerned. I cannot accept the argument that what you're doing in accepting or forwarding your recommendations about this amendment is for each person's own good. No one single medical or scientific view can ever cover every person in every situation. When faced with a medical problem, I have the freedom to consult several physicians about the same issue, and I would be very surprised if all of them gave me the exact same answer, let alone if my friend or neighbor or family member had the same medical condition and consulted several other physicians as well. Therefore, for each individual, the final decision about which medical course to take inherently does and should rest with them. So I can only appeal to your sense of right and justice. Please do not try, yet again, to take more of my rights and freedoms away. Please do the right thing and tell the Eau Claire County Board and the Eau Claire City Council that you do not want the proposed changes because you do not want to overstep your bounds, and you're willing to curb your own power to the higher call of doing what is right. Thank you for your time.
Thank you very much. The next speaker we have is Dave DeVille. Dave, are you on the line? All right, can you give me just one moment? I'm just going to mute a couple of other lines here, and then I'll let you know when you can go ahead.
Finally, I mean, of course, these guys have been that I bought summer, trying to get plans. I got a real estate going. They were not done, so they're not happy. But anyhow, they accepted some cash offer, so I think I'm not taking them to do it. So, but anyhow, you guys are coming.
All right. Dave, you should be able to go ahead now.
Thank you. To those at today's meeting, the ordinance proposal which is being discussed is frankly terrifying. If the proposals to grant open-ended powers to the local health officer are, as they see fit and by any means necessary, were to pass, liberties and freedoms would be revoked from citizens and businesses alike. This is into the new contagious disease news section. The issue with general orders and general application that the officer can do. I understand that there are checks and balances in place where a review and written consent by the city manager acting as the emergency legislative capacity would be in effect, but that is one person. I think about my clients and my peers who adhere to CDC, state, and local guidelines set forth over the many months of the COVID-19 pandemic. My clients have spent thousands of dollars planning a celebration of marriage, a school dance, a town festival, a dance competition, only to have restrictions put in place. Plans, money, and the like have been canceled, postponed, or moved out of the city and county due to current restrictions. Myself and my peers have lost revenue because of the restrictions of the health department And as a small business owner, I survive on live events, in-person events that bring community together to celebrate. After Wisconsin opening back up, life has seemingly started to look more optimistic. But the thought of individuals and businesses being fined for following what precedence has already been laid out, and the scare tactics and the new ordinance of a health officer having the power to shut down a private business or an individual conducting their own business without government overreach is out of control. I think about the small businesses in the city and county, many of whom can be heard advertising on my radio show, and what this may do to them. Restaurants and taverns, salons, barbers and tattoo parlors, and many more who have barely made it through the first public health emergency and were forced to close illegally. What will this new ordinance do for them? Will they survive? Would they want to keep their doors open with the fear of someone might come in, find them for following guidelines, or worse, order their doors shut? Small businesses and individuals have done what they've been asked of them during this pandemic. Be safe, be smart. Protocols have been established, precedents have been set, and I urge you not to make the change to the current ordinance and grant what seems to be carte blanche to a local health officer. Thank you.
Thank you very much. Our next speaker is Rebecca Zimmerman. Rebecca, are you on the line?
I am.
Okay, if you can give me just one moment, I'll let you know when it's time to
That
speak.
one is probably
Rebecca, you can go ahead.
Thank you. Thank you for allowing me to participate in this call this afternoon and for your service to our community. I think it's clear that there is a lot about this statute and ordinance that's either not understood or misunderstood. I believe one of the biggest factors causing this is the lack of direct communication and inability to meet face-to-face and exchange dialogue to determine if we agree or oppose. It certainly also isn't helped by limiting speakers, speaking time, and emergency meetings with little notice. I'm sure you can understand how you haven't gained our trust. We deserve to have a transparent picture of what is happening in our county. In other counties in Wisconsin, they have been very transparent and forthcoming, willing to speak and explain things in layman's terms. It appears from correspondence that I have received that even our Board of Health, City Council, and County Board are confused and unsure of the details of these statutes and ordinances. I'm a lifelong member, resident of Eau Claire. My family is not interested in your overreach. The best authority over my health is myself. The idea that myself and my children could be forced to receive an untested vaccine should be alarming to absolutely everybody. I am now begging for your transparency on this issue. And actually, I'm not even begging, I'm demanding it. I have lost sleep wondering, what do you deem reasonable and necessary? What is any means necessary? I feel it's probably vastly different than mine. I think it is important for our community to be aware also of the WCA, which is the Wisconsin Counties Association, and a somewhat mysterious nearly $2 million that it has been or will be allotted to our county in regard to this ordinance under a public health emergency. I thank you for your time, and I look forward to the clarity that I am expecting to receive from you very soon. Thank you.
Thank you very much. Our next speaker is Randy Stoufferan. Randy, are you currently on the line?
I am, yes.
Okay. If you can hold on just one moment, I'll let you know when I have the rest of the lines muted and you can go.
Thank you.
Randy, you can go ahead. Randy, can you hear me? Randy, are you still on the line?
You're not talking about. You're talking about is
Randy, are you still on the line?
Yeah, the last one.
Yes, I am.
Okay, I'm sorry. Okay. Go ahead, Randy.
Well, I want to first thank you, although I appreciate the opportunity to speak with you here today. I must say I'm hugely disappointed in the format which you've chosen. There have been many other people have expressed this same concern, and the fact that you can't hold an open meeting where we can speak with you face to face. It's embarrassing to see that our local government is handling business in that way. So I'm embarrassed for all of you. You could have found any format, any venue here in the city large enough to handle all of us who wanted to speak. So, number one, I want to express my disappointment in the manner in which you've held this meeting. I am calling today to speak in opposition to any ordinance that you have proposed or might propose. And it's interesting, in your opening comments, the young lady who gave her narrative of this ordinance specifically said, number one, this is not granting any additional powers to anybody that they don't already have. So why the ordinance? Drop it. You got all the power you need. Secondly, who has a right to tell me what to do with my body and how I want to take care of my family? And it's a common slogan out there today, been chanted for several years now, my body, my choice. Does that not apply to us as well? I've had the opportunity to attend other meetings in other communities relative to this issue. They're open. They're taking testimony face to face. The last meeting I attended, we spent 5 hours from 7 o'clock until midnight cutting and dicing the numbers every which way you could. The bottom line here is that this is not about COVID. This is someone's agenda. I don't know whose agenda it is, but we've had 7 months of this, and people have taken the time and made the effort to educate themselves because of all the contradictory information that's been shared with us. It's not about COVID. In this case, it may be something personal. The Director of Health and Human Services served on the Wisconsin Association for Counties, helping to draft this amendment, this ordinance.
We are at 3 minutes, unfortunately. I am going to stop the commentary at that point. But our last speaker for today is Karen Mueller. Karen, are you on the line?
Yes, I am. I am on the line. Hello, can you hear me?
I can't hear you, Karen. Just one moment. Karen, can you go ahead?
Yes.
You're ready to go.
My name is, I'm an attorney licensed to practice law in the state of Wisconsin. I served on the Bar's executive board of the Civil Rights Section for the past 5 years. I wish to speak today in a limited representation capacity on behalf of Patriots United, a growing Christian conservative group in the Chippewa Valley, regarding your consideration of the amendment of Chapter 8.04 entitled Contagious Disease by the creation of Section 8.04.021 Local Health Officers Orders. First, I wish to respectfully remind each of you that you do not have the authority to empower unelected officials to create unconstitutional orders in this city or county. We, the people, are the only sovereigns in the United States of America because our country is a constitutional republic. That basic principle is true at every level of government. We have a U.S. Constitution that includes the Bill of Rights and a Wisconsin state constitution, all of which protect us, we the people, from governmental overreach. Secondly, you are the elected officials that represent we the people of the city and county of Eau Claire, Wisconsin. As such, you have a duty of oversight based upon your oath of office to ensure that all ordinances or orders adopted by the Eau Claire City County Health Department are constitutional. Third, the judgment and order of the unelected official can never be beyond the reach of we the people. For this reason, I take issue with the last statement in Chapter 8.04021, subsection C1, that states, if the order is not considered by the City Council within the duration of that order, the order shall be deemed approved. You, the board members, are not relieved of your duty to ensure that an order is constitutional by simply failing to consider it. Finally, every constitutional order that comes out of the health department must be necessary given the current circumstances and accurate scientific evidence. Even if an order is found to be necessary under the circumstances, it must also be reasonable in order to pass constitutional muster through the use of the health department's police powers when an official is attempting to burden a fundamental constitutional right. Therefore, if it does not meet these highly subjective criteria, then it is unconstitutional and unenforceable. It is your job to ensure that these criteria are met when fundamental rights are at stake. If you are going to adopt this amendment regarding the local health officer's order, which I am not in favor of, at least please change the paragraph I addressed so that you are required to provide oversight to each health department order that implicates fundamental rights.
We are at 3 minutes now. That was the last speaker that requested to speak during the meeting time.
Thank you, Tegan. I want to thank everyone that took the time to speak. I can tell there was a lot of thought and passion put into your comments, and it was good to hear from you. And again, we also do consider the written comments that were provided with the people that couldn't be here today. I also wanted to mention, in case people weren't aware, is that this WebEx meeting is being recorded. So do know that it includes all the public comments as well as the business section of the meeting. Okay, moving on to our business item. To start our discussion, do I have a motion to review and provide input to City of Eau Claire and Eau Claire County ordinances relating to communicable disease general orders? Jennifer, thank you. Do I have a second?
Martha, second.
Okay. Liz had her hand up too. So Jennifer made the motion and Liz seconded. So to get us started in the discussion, I would like to start with a brief overview from Liska in terms of any of the items she wanted to call out in the material we have, and then we'll open it up to Board of Health discussion with all of us here that are online, including staff from city and county.
Thank you, Mary. And thank you to the board members for making time for this meeting. And thank you to all of the people that are engaged in being part of this meeting, both those that are listening in and those that provided public comment. The Board of Health you have in front of you the overview fact sheet, the couple of pages that were provided about the ordinances. You also have an ordinance from the county and from the city of Eau Claire. So there are 2 ordinances in your packet, as you are aware. A couple of quick things to highlight for you from the fact sheet. And thank you to Janessa for walking through in the beginning some of those pieces as well. Typically, general orders, the kinds of orders that are being looked at with these 2 ordinances, are things that are done at a state or national level. So do remind, and a reminder to all of you that this type of order has never been done at a local level in this state that I am aware of. And because we don't have a state order or a national order, we have this unusual circumstance currently. But again, that reminder that is an atypical circumstance. We also, as you know, and you see in your packet, there's some basic state statutes that frame what we do in communicable disease every day with the communicable diseases that we respond to as a health department. Certainly, you count on all of us to do that work related to tuberculosis or measles, and it happens with every communicable disease. What you have in front of you, again, is an ordinance from both the city and the county, as Janessa walked through, that is not about expanding control. It's about taking the basic state statutory language, which was written many years ago and never tested, that says to do what's reasonable and necessary, as you heard a number of our speakers talk about. It takes that language and provides an Eau Claire frame around the 2 components that were talked about, the procedural issues that have to be followed and the substantive issues that have to be followed in order to have an enforceable order in the county and in the city. Procedural, meaning how the order gets processed through, and substantive, what the order can be about. So you'll see language in each of those ordinances that really talks and walks through those specific frames that are not currently in state statute and would be additive here locally. To date, there have been conversations across the state about local ordinances and local orders. As you're well aware, and we've talked about at previous board meetings, the Wisconsin Counties Association partnered with many statewide organizations to look at the issue of local orders. Again, something that hasn't ever historically happened. That Counties Association group did talk through the need for local enforcement mechanisms, the ability for citation authority so that these weren't criminal charges if a community decided to move forward with a local order. So importantly, these ordinances include that aspect. Again, citation being something that is not as serious as a criminal charge. And certainly the Wisconsin Counties Association also talked about the important look at what does reasonable and necessary mean in our state. Our community also worked with the National Network for Public Health Law, as well as other experts to look at best practices. And Janessa Stromberger, who you heard from earlier, really did the research to look at what the potential options were for putting an ordinance in place. The Board of Health today is being asked to review these ordinances and provide your input as the policy body for the health department, as the group that, according to statute, is in that governing role for state statute to look at health department activity for communicable disease. As you see in your fact sheet, there are a number of next steps after your review and your feedback. The Eau Claire City Council at their next 2 meetings right now are queued up to have a first reading of the draft on the 22nd of September. Eau Claire County Board would have a first reading on the 6th of October. And then there would be public meetings where there would be additional opportunities for public input to both City Council and County Board in October, with final action, if this moves forward as expected, on the 13th of October at City Council and the 22nd of October at the County Board. Those dates are all listed in your packet. Again, for discussion today and for Board of Health questions today, we do have Janessa Stromberger available for legal questions. I can certainly answer general public health questions. And we have others available as well from the city and county if any of you do have those types of questions.
Thank you, Lisa. So I would like to open it up now for board members' questions and discussions. And again, I'd like us to take advantage of the people we have online so we can be clear about what feedback we believe is appropriate to move forward to the city and the county. So would somebody like to start with a question or comment?
Mary, I have a question.
Sure, Emily, go ahead.
So what I'm figuring out after I've had phone conversations with people and through the numerous emails of the our engaged public, which is great to see, a lot of it comes down, which we heard this afternoon as well, a lot of it comes down to people, well, so the question about mandatory vaccinations and children being forced out of their homes or taken from their homes. So I'm wondering if this ordinance would allow mandatory vaccinations and for children to be taken out of their home against the parents' wishes. So I don't know who wants to answer that, but a lot of times that's what the questions kind of boil down to.
Thanks, Emily, for that question. This is Lisa. And I'll start with an answer, but also certainly we can have important legal perspective as well. This ordinance is really about those generalizable orders that would apply across the population as a whole. Some of the comments I know we've gotten in writing and verbally have raised concerns about individual action, and there are communicable disease approaches for individual action. So, for example, if someone has a child with measles and insists that they're going to take their child with measles to daycare, we do have the ability to say, no, you need to keep that child home. You may not bring them to daycare to spread measles at the daycare. That child is not taken away from their family, but they are not allowed to go to daycare. That's the kind of individual control that is available in our existing state statute. That is not anything that is impacted by this ordinance and would not be impacted by this ordinance. And it's an important, people want to be able to be sure that they are not going to have diseases spread to them when they are out in the public. So again, this is a general ordinance that would apply across a population and not related to individual action. There has also not been any case that I am aware of mandatory vaccine. We do have state laws, again, not local laws, related to vaccination requirements for school attendance. And those requirements are set at a state level for making sure that vaccination can happen. But again, there are options for families with that, even that mandate. And it looks like our county legal counsel, Tim, might be able to add to that.
Hi, this is Tim Sullivan. I'm the Corporation Counsel for Eau Claire County. My office prosecutes child in need of protection services cases. Those are cases where children are removed from home. Generally, the grounds for that are the children are neglected to the point where there's a risk of physical injury or danger to the child, or abused. Failure to follow a health department order in this situation is very unlikely, if almost impossible, for the county to bring an action to remove a child for failure to follow a local health officer's order. So the likelihood of that ever happening is probably about zero. With regards to vaccinations, this office also prosecutes cases concerning vaccinations. At the present time, there is a law in place where you can be a conscientious objector, essentially. You can say that you don't want the vaccination and not vaccinate your children. That happens on a regular basis. We get those referrals from the schools. We deal with those situations. There are people that refuse vaccinations on a regular basis. There's nothing in this order that mandates that vaccinations be done. The reasonable and necessary is to prevent the spread of disease. If you look at 252, the chapter that's involved with this, the public health order, most likely what would happen to prevent the spread of disease is that there would be an order for quarantine or isolation. It would not be a mandatory order for vaccination. So.
Martha Neiman with a related question. When I read the language about removing somebody from their home or putting them in an institutional setting, I relate to that to the history of tuberculosis sanitariums. Maybe it would be helpful to contrast that situation with the current situation to clarify why this is being included in this ordinance.
Again, I will, Martha, attempt to answer that question, but again, tuberculosis has very specific statutory language related to that disease in particular. And many, many years ago, people were removed and put voluntarily into a sanitarium where they were able to recover away from others because there were no medical treatments available to prevent disease from really killing people. So that's a historical institution that no longer exists. People with TB now stay in their homes and they're told to stay home so that they don't spread disease. What we're hearing in comments appears to be utilizing some of that language and wondering about that kind of authority being available given disease spread currently. And again, as Tim described, individual action is not part of the existing ordinance that's being presented to you for feedback.
Anyone else? Jennifer?
Hi. So I guess I would direct my question to our legal experts who are sitting in. Thank you for participating. I heard Janessa's initial statement that this does not in any way expand the health officer's authority, but just reiterates the current authority and also speaks about constitutional safeguards or legislative oversight of that. And then I hear many people in the community being concerned about overreach for whatever this is necessary and reasonable, unspecified authority. So I guess could our legal team just comment on, is this an increase in the health officer's authority or not?
Sure, happy to address that point. Again, not an increase in the local health officer's authority. This doesn't grant them the ability to address any situation that they already can by state statute. What this does is provide legislative oversight of what they're ordering for a general order. Provides for the public input, and then it allows for whatever that order is. After going through that process, that order is then enforceable. That's the only differences from what is currently enabled by state statute. So it's not giving them any additional authority to address anything new with this ordinance.
So, and in effect, too, if I understand you correctly, that the people who are providing legislative oversight are elected officials. Like there was a lot of concern that there is authority being usurped by unelected officials, but in fact, this ordinance empowers elected officials to provide oversight of the authority exerted by the health officer.
That's correct. The, and of course for the city of Eau Claire, that's the city council. For the county, that's the county board, all elected officials. And those are the boards and councils that have the ability to overturn or strike down any part of or the entirety of an order that they would disagree with. Elected officials have the ability to do that. And then of course the ordinance also requires, as does statute, reporting to the Board of Health, which is appointed by those elected bodies.
So I really appreciate that clarification, and I hope that the people listening in hear that, because I think that was a really strong concern. I guess following up on that, because like many of the people commenting, I'm not a lawyer and I'm not good at understanding legal terminology. How is it that, or could you explain this issue about giving citations as opposed to criminal charges? I'm thinking if a business is not complying with the recommendations and has been warned or whatever, that they would then get a citation or something like that. That's how I'm imagining it being used. And I'm wondering, is that a new authority for the health department, or help me understand how the citation issue plays into this legal order?
Sure. So citation authority, of course, is not new for the health department. They have the ability to issue tickets and do, when circumstances warrant. They usually go through a very detailed, informative process before a ticket is issued, and of course, that's what would be recommended in these circumstances as well. The ordinance requires, of course, that there be publication of the orders, and that everything that this order is based on be well publicized and available for inspection, so that the public's on notice as to what the requirements are, so that it shouldn't be a surprise to anybody as to what the expectations are for the behavior related to the public health order. So if tickets were to be issued, it would be after a lengthy public notice process, and routinely involves communication with the individual or business that would be on the receiving end of a citation. And of course, a citation is different than a criminal penalty. A citation is just a monetary penalty, not criminal, which could, of course, involve jail or some sort of confinement as well. So just a civil forfeiture would be the penalty for the city and county ordinances. And then the city ordinance also includes the ability to prosecute as a public nuisance, which is something that the city occasionally will have to deal with, a public nuisance, and then also the ability to consider violations in the city's licensing capacity as well, as the city licenses any number of establishments or businesses across the city.
So that's really helpful as well. I guess I don't want to monopolize the floor. I have another question, which is more directed to our city officials or county. Just why is this ordinance or this order, this general order? I'm going to mute myself after I ask this. I have a dog barking. I apologize. What is the impetus for needing this general order?
Well, this is not a general order. This is an ordinance. The general order is something that would come about from the health officer in times of need, when there is a pandemic and there is a need to control the spread of the pandemic or the epidemic. What we're doing is we're proposing an ordinance to provide the guardrails and the controls of how orders would be put into place by the city, by the health officer, and then reviewed by the city and the county.
This is Martha. I have a couple of related questions. In my reading of both the city council and the county ordinance, am I correct in thinking that due process is included if citations or measures were to be enacted for people, that there is due process allowed individuals to contest those kind of mandates that are applied? Is that correct?
Yes, absolutely. They would have a right to trial before the court.
I'm interested also in hearing the legal perspective on the comment that was made by one of the people from the public about the validity of the failure to act language that's in those two ordinances, that if the city council or the county board does not take action, that the order is allowed to stand. This person objected to that particular language. Could you speak to that?
Essentially, that language is there for the purpose of allowing the city council or the county board to review the ordinance for purposes of determining whether or not, or the order for purposes of determining whether or not they're going to invalidate or change the order. And if they fail to take action, then the order remains in place. The language is there; it's appropriate. It's commonly used in this type of situation. That essentially what it's saying is that the city council or the county board has the opportunity to review it. They may decide to take action, and they may decide not to take action. And if they take no action, then essentially what they're saying is that the order remains valid.
So that's basically a measure of convenience. Namely, if we agree with it, then we don't have to go to all the trouble to say that we agree with it.
That would be one way of describing it. That would be one way of describing it, yes.
Okay. There are some differences between the city council ordinance and the county board ordinance. Could you explain why those differences exist?
Some of that has to do with the laws that apply to the city and the laws that apply to the county. They're not the same, and the authority of the city and the county are not the same. And so that's some of the reasons why. The substantive language, though, is fairly identical. Mm-hmm. And otherwise, it is just the way they were drafted. They were not drafted, they were drafted simultaneously, but not necessarily together. And what we did was we got together and worked on the substantive language together. And those, if you read that language, it is fairly identical in both ordinances.
Yeah, I think it had to do more with the time limits and specific fines and that kind of thing.
Yeah, the city does have the nuisance and the permitting issues, which are not issues for the county because we don't have ordinances of those nature.
Mm-hmm. Okay. Thanks.
So Don, did you have any questions or comments you want to raise?
No, I thought it was well written. I appreciated all the comments, and I appreciate all the clarifying questions that have been asked by other board members.
Okay.
I feel comfortable moving ahead towards a vote on this.
Okay.
This is Liz. I do have a question when it's my turn.
No, go ahead, Liz.
Well, a number of the comments from the public addressed science and what is the foundation of the decision based on scientific evidence compared to, well, various sources, I guess. Certainly in the days of the internet, there's lots of information floating around which may or may not be attributed to modern scientific methods that are recognized by scientists. So I'm wondering, a lot of the questions related to the reliability of the data, like we only have 6 deaths, it's not a pandemic. Why do we need to have this? And I'm assuming that is based on your review of public health science that from trusted sources. So could you address the source, Eliska, of how you came to this decision and the science question?
Certainly. In state statute, one of the requirements is that all of the work we do in communicable disease is based on science. That is part of the frame that we are expected to use. In our particular order now, we certainly, as we would always do, work with the state health department, who are our communicable disease experts. They are the ones that are responsible for framing practice in the state and the data that we use. They also obviously rely on the Centers for Disease Control as their primary source of communicable disease expertise and research. So the partnership between the federal government, CDC, the state health department, our Wisconsin Department of Health Services, and then at the local level, looking at the actual disease case numbers and what is happening in our community related to the population would all be part and is all part of what we work together on in order to develop any type of order. This ordinance lays out some very specific requirements for what that looks like and how it needs to be presented. So as board members, you're well aware that at all of the last board meetings, we have shared with you the extensive data in this specific pandemic. We have shared with you what those best practices are and why we are continuing with, in this case, an order that is related to the risk factors of this specific disease, the 6 feet distance, the numbers of people indoors and outdoors. Those kinds of factors are based on science coming from our national and state experts. And we present that to the Board of Health as part of our requirements. We develop our order on that. And this ordinance at the city and county level would require that frame as well.
Okay, thank you. I do have one more question. Mary, if I could go ahead. Several people are concerned, actually a lot of people were concerned about the vagueness of the language, and I probably this would go to the attorneys on the line, specifically reasonable and necessary for prevention and suppression of disease. That phrase seemed to be of a concern to a lot of people in our public speakers and the comments.
Certainly happy to address that. So the state statute mandates that a local health officer act as reasonable and necessary. So that's where that language originates from, is our state statute. That's the enabling statute for the local health officers' grant of authority have as our starting point. And then what we've put in the ordinance are the safeguards to protect that authority from being too expansive. As is required by our Constitution. So we've got procedural safeguards as well as some substantive safeguards that are, they're put a burden on the health officer. I'll be frank about that. They're a high standard for the health officer to meet as far as the reporting requirements, what the order has to be based on, and all the steps that have to be met in order to produce an enforceable order. So reasonable and necessary, no, it's not. It doesn't tell you exactly what that might mean. And of course it can't, because when you're looking at an order that might be issued under this ordinance, you don't know the situation that it's going to have to address. That's part of the point of it, is that it's a new situation, a situation that we haven't likely faced before. And so it needs to have the ability for the health officer to respond under those circumstances.
Okay. It does seem like there's a lot of fear, partly because of the uncertainty, and that makes me afraid too, frankly. We just don't know, as this is a new circumstance. But at least is just to reassure people, is it possible at all even to give examples of what might be a reasonable and necessary action?
I'm trying to interpret your question correctly, Liz, but this ordinance is not about COVID-19. This ordinance is really something that would, serve moving forward. In some ways, it's the worst time to do an ordinance like this because we're in the middle of a pandemic, but the frame for reasonable and necessary and the way the ordinance is written is really defining more clearly how to determine what might be looked at to make sure that things are reasonable and necessary. So if you look under the substantive safeguards as in particular, there has to be purpose for what you're doing. What are we trying to accomplish with the order? There has to be clear description of what the findings are. So really digging into the data, digging into the best practice and saying, what are we seeing across, in this case, across the world with COVID-19 in this specific case? How does that apply locally? What is our population risk if we're trying to prevent COVID-19? Now we're trying to respond to COVID-19, and that would be similar in any pandemic situation, and to continually update the data and the science as we learn. The challenge with a novel disease and why it's so important that the health officer or whomever is in this position regularly comes back to the Board of Health and with this proposal to the elected officials with the data and the best science is that we are learning. This is a disease that's only been around in the US since January. It is a novel virus, and we have learned over the course of time what the transmission routes are, what the ways to slow transmission are, and now learning about treatment modalities. So those are important scientific changes and updates, and those should be built in to all of the work we do as health officers.
Yeah, thank you. I do have one more, if that's okay. It is
yes, go ahead.
The frequent references to constitutional rights and the Wisconsin Supreme Court decision in March that negated Governor Evers' position order for the state. So how does this ordinance address the Wisconsin Supreme Court decision? That's not the right way to phrase that, but I'm wondering how in the wording did this ordinance consider that decision?
Certainly.
Maybe attorneys would be the ones to answer. I'm not sure.
Yes, certainly happy to answer that one. That case, the Palm versus Wisconsin legislature case, is one of the primary reasons that we're bringing the ordinance and played a big part in the formation of this ordinance, as did other case law and the recent Supreme Court order that came out just at the end of last week about Madison-Dane County's health order. The ordinance is also based on feedback that we receive from a public health law expert, a topical expert in the field, and as well as other academic writings. So we've taken as much Wisconsin case law as there is on the topic. We've taken it all into consideration in the drafting of this ordinance and really crafted it carefully to allow for the legislative oversight that is so necessary. And that's, one of the primary reasons that the state order was struck down back in May. So we have definitely taken that into account in the drafting of this ordinance and hope to avoid the pitfalls that the state order ran into.
Okay, thank you. Thanks.
This is Martha. I have a couple of questions and then one point to make, if that's okay. The statement that I want to make has to do with the comments that we heard that were specifically stating that the death rate to COVID in the local area was very minimal. And I guess the concern that I have is that as far as I am concerned, the death rate, it seems like in this disease, is only the tip of the iceberg. That we haven't heard a lot, statistically anyway, from the local area about morbidity that can occur with this disease. I think that, I mean, obviously we're learning a lot about the disease. We don't know a lot about it, but it seems like there are potential significant and long-term chronic consequences that can occur to people that don't succumb of the disease, and that includes small children. I know that the health department is working hard as it is, but it might be helpful to have more information about those consequences of surviving the disease. One of the questions that I had related to the ordinances is I'm curious as to what the impact of the existence of these ordinances has on the role of the Board of Health. The Board of Health was mentioned, I think, in one of the ordinances, but not in the other. Where do we stand in relationship to what our responsibilities are related to the ordinances on the city and the county level?
And I'll answer that quickly for you, Martha, but then Janessa will also jump in. But as described in the fact sheet, the state statute does speak directly to the governing entity related to communicable disease and related to oversight of the health department. So you have a couple of references in your fact sheet related to that. The Board of Health by statute is the entity right now that I do have to make a full report to before doing something related to communicable disease. And that would continue. That responsibility in statute remains there. So the example of our existing process right now of me describing the current situation with COVID-19 and then you having on your business agenda an opportunity to review the current order and receive that would be the same kind of process that would continue in other pandemic situations. As the governing board, it's I have a requirement to make a full report to you and for you to review that and provide input. You're also my boss, so you also have the important job of making sure that I'm doing my job. So that's an additional responsibility of the Board of Health that does not go away with this ordinance. But I can certainly have Janessa add some additional thoughts as well from the legal perspective.
Sure, and I think Lisa covered it pretty well, but I would just add in that in the city ordinance under E1, and I know it's in the county ordinance as well, although I don't have the reference right in front of me, the Board of Health is the first body that the health officer is making a report to when they're looking to issue an order under this ordinance. And as Ms. Giese pointed out, you know, that's the statutory requirement as well, is that she make a report to that governing body, which in Eau Claire is the Board of Health. So that stays consistent under these orders.
So in essence, what this ordinance is doing is placing two other levels of supervision, as it were, beyond what the Board of Health already does. So adding on. So more reports, correct?
That's correct. More reports, and in this case, additional reports to bodies that are elected by the public.
Okay. And I guess then that also allows the potential for either of these other bodies to act and say, no, we're not going to allow this. Okay. My last question has to do with some wording in the substantive standards section of the county ordinance. I couldn't find it in the city. It might be there, but I was wondering if someone could give examples of non-discriminatory classifications. I mean, I think it's really important. Another important issue in this date and time is equity and non-discrimination. So I think it'd be helpful to know what those kinds of classifications might be.
Those classifications would be your standard discriminatory classifications. You can't make decisions based on solely on something such as religion, race, so on and so forth. It has to be content neutral, based on the disease, based on treating the disease, preventing the disease, those sorts of things. And the language is also in the city ordinance. They actually had it first, and I then put it into the county ordinance when they drafted it.
Okay.
Martha, is it? Yeah. Okay. This is Mary, and I have a couple of questions too. First of all, I'd like to say that I really appreciated that the city and county did a lot of the operational steps using same requirements. So it's not like each organization is expecting the Board of Health and the health officer and the health department to do completely separate things. So that really, to me, made it helpful and functional. The other thing that I wanted to better understand was that if once the ordinances are in place and there is a general local public health order in place, then could you just clarify and reinforce the frequency of when that would be reviewed by not only the Board of Health, but the city and the county? I think some people looked at some of that and understood that it could go on for like a year and not have any oversight. Could somebody speak to that a little bit?
Certainly. The 6-month timeline that I think people were looking at is the duration that a health officer could issue any orders during that time period out of the same incident. But each order could only be up to 30 days in length for both the city or the county. And at any time during when an order is in effect, those governing bodies, the city council or the county board, could review those orders and take a vote on them. So each order no longer than 30 days could be issued up to 6 months in duration for repeated 30-day periods. And then the county board or the city council has the ability to extend that 6 months in 2 additional 90-day periods, getting you up to a year total for that same incident. And then once you've gotten to that year, if regulations are still necessary, either the city council or county board would have to act to impose direct legislation, impose an ordinance with those requirements specifically, or the order could be advisory.
Okay. And then on that same theme, when the city and the county are looking at an order that's in place and one of the groups approves it and then one doesn't. So let's say it would be, if the city didn't approve it, it'd be advisory in the city, but the county approved it. So it would be, there would be enforcement in it. And the public health concern I have there is we see what happens across the state and across the United States when, as there is less and less consistency between geographic areas, it becomes much more difficult to take steps to control the communicable disease. And so I don't know that there's a good answer for that. I'm just raising that as a point of where I can see from a public health perspective that we could have some issues. And then if we have to go, if it takes longer to get agreement about the course that the city and county want to take, or if it's one of the times when the city manager is signing off, and it takes longer, then it means that it's taking, the communicable disease has a better chance for spreading during that time. So I don't know how we think about that moving forward, but I can see that as a speed bump in this process.
So Mary, I'll just respond that yes, it would be accurate that there are potential spots along the way with this ordinance that things would not be uniformly done across the county. The goal of the health department is always to work first to find consensus and work on strategies that those elected officials would see as acceptable approaches. But certainly in an emergency, immediate action could happen. And then there is a possibility that there wouldn't be uniformity in how that moved forward within our community. A reminder to everyone that the likelihood of this kind of scenario happening is very low. Typically, again, these would be state orders, like we have the state mask mandate now, but it is giving, the possibility is there, and the goal always with the health department is to work in collaboration, using best science to make sure that people understand the risk and preferably moving forward a uniform approach.
Okay, thank you. The other question that I have is in reference to the sections about publication. Does it require it to be published in a newspaper, or are there other methods that could be used? For instance, since we now don't have a weekend newspaper, it could be a gap of 4 or 5 days. If something happened on Friday that there were going to be steps taken, then it would have to wait to be published early in the next week. Is there other mechanisms to use, for instance, TV, radio, social media, whatever, to get that information out, or is it always going to require a newspaper?
Sure. So the ordinance addresses that in the city version in E4 publication, that's the paragraph on publication. And so publication is required. Currently, you're correct that a Class 1 notice goes in the newspaper. Of course, statutes update to reflect the times. So I imagine a newspaper will not always be the method of a Class 1 notice, but it is currently. So publication in that manner is required on the initial issuance of an order or upon the renewal of any order in which the substantive requirements have changed, except for paragraph B, which is when an order is issued concurrent with an emergency declaration in the city. And then under those circumstances, publication is just as soon as practicable. So when an order is issued under that emergency declaration and has the sign off of a city manager, then the ordinance is just required to then comply with paragraph 5, which is to distribute through posting effort on the city website or at the city library. Kind of that distribution means that you were referencing through social media and radio and that sort of thing. Those would be the efforts that we would be looking for if an order is issued with an emergency declaration.
Okay.
Hey, Mary, those are in 8.30.060 subparagraphs D and E of the county's ordinance.
Okay. as our newspaper diminishes, I can see that becoming an issue at some point. Okay, thank you. Are there other questions or discussion that we need to have?
I just wanted to make a quick comment. I was trying to figure out how to say this exactly, but there were a lot of comments that I saw about, I don't trust you, or maybe there's $2 million coming in, and that's how you're making your decision or whatever. And I just think these are really fraught times, and I think we're all sort of a little more suspicious of one another than normally. And I just wanted to say that I've been on the Board of Health for, I don't know, I re-upped, so probably 7 years now. And so as the boss, you know, or one of the members of the boss, first of all, I just want to say all the Board of Health are volunteers serving our community, trying to do our best with whatever we bring to the table. And as Liska's boss for all these years, what I would want my boss to say about me, if people were questioning, is just, I have seen such ethical behavior. When things are at all questionable, she is clean, squeaky clean to the letter. She's extremely hardworking, and if we have questions, always returns back to the science. Since I've been involved with the health department, the fiscal oversight has just been tremendously improved and very conservatively done and ethically done. She works with the Chamber of Commerce, you know, always with this COVID issue where people see things differently. She works for consensus and collaboration and works strongly with all our partners, including our business partners. And I have nothing but pride speaking to the behavior of her as health officer and the health department. So just want to put that out there for the good of the community.
Thank you, Jennifer.
Mary, this is Dale, if I could.
Yes, please.
Just Jennifer, thank you. I believe that many and most of us on this call support the feedback that you just provided. I would like to address the comments that have been made about money coming in, and I want to just be very clear and on the record that there is no more money coming or being available to the city of Eau Claire if this ordinance is passed and moves forward.
Thank you, Dale.
Mary, this is
Yes.
Catherine Schaff as well. And I would like to also say that the county receives no money or additional money in working on this ordinance.
Thank you, Catherine. Yeah, I appreciate that there are lots of assumptions made and stories started, and it's easy for things to get a little distorted as people hear more stories. So thank you both, Dale and Catherine, for clarifying that. Is there anything else in terms of, before we summarize this, is there anything in terms of public health principle, Board of Health responsibility, health officer expectations around this, or intent from the legal perspective? Any of those things that are still outstanding questions for you that we need to address now? It looks
Mary, you're muted.
Thank you. In terms of the next step, we are needing to summarize our feedback from the board to both the county board and the city council in terms of these ordinances. As I've listened to what everybody has had to say, there was a lot of discussion that was reflected more towards the comments, public comments coming in, both written and verbal. which I don't know is something that is appropriate in terms of what is being looked for with the specifics of the ordinance, because I think our questions have been answered in terms of what is happening, what is not. Is there overreach? Is this giving one person more power? And it's been made clear that that isn't the case, and that this is providing some of the very guardrails that people were asking for in terms of this. Elected officials needed to be involved in this process, and this certainly puts them there. So unless there is something else, it is really then what I'm hearing is that it is appropriate to say that we have no specific feedback going to the city and county regarding potential issues, changes, concerns. Any feedback from any of you on that? Have I summarized it correctly? Yep. Okay.
Well, if I could, I was just, well, it's my understanding, there was a question as well about who drafted it. And so, and then when I think about that too, as I make this decision of all the people that put this together, and it sounds like it was definitely a group effort. It wasn't just one person drafting this. It wasn't even the health department drafting this, from my understanding. I mean, they took input, but it was legal on the city and the county level. And I'm sure, and the input from many different officials. That's my understanding, and that's what I think about as I go forward too. So my understanding is wrong, please correct me, but that's what I'm basing this off of.
Does anybody from the city or county disagree with that? They appear not to. I think you have it right.
Mary, I think your point about differences in what happens if the city and the county enact different measures or approve or disapprove different orders, I think that's well taken, and maybe that might be a comment that needs to be passed forward to whoever needs to take a look at that to determine, well, what would we do? Certainly. Is there a way to prevent that kind of problem from arising?
Certainly. Okay. Don, did you have something?
Yeah, Mary, I guess I would just come back to the summary. Who's worked in and around public health for many, many years. I would say that rather than having no comments, I would say that from a Board of Health perspective, this seems like a very appropriate preventive public health measure to be undertaking at this time, given the absence of actions at higher legal levels, that is, higher political levels. So I would encourage us as a board to say that need is a well.
Okay. Okay.
That's all.
So at this, thank you, Don. At this point, then, what we will take a vote on now is moving forward with what Don was just indicating, as well as what Martha repeated about the if there's not agreement and how to consider that as we move forward. Is there anything else to add to that summary? Okay. So with that, I think it's time to take a vote. All those in favor of providing the input as summarized indicate by saying aye.
Aye.
Aye. Okay. Opposed? No. Okay. Great. Then, unless there is anything else before we adjourn, I especially extend our thanks to Tegan and Gina for making this work behind the scenes. We appreciate all the time you invested in before the meeting, as well as how you made the meeting happen. That's greatly appreciated. Also, thank you very much to the city and county staff that joined our meeting today. It was nice to have you here and able to respond directly to our questions and feel good about being able to move forward confidently. So with that, do remember that there is our regular September Board of Health meeting on September 23rd, and we'll be dialing back in at that point. And at 5:40, the meeting is adjourned. Thank you, everybody.
Thank you.
Thank you.